Now, hundreds of intern doctors Monday morning flocked the Ministry of Health headquarters seeking to get their employment letters, which they were promised 2 months ago. The interns are vowed to down their tools until the Ministry of Health addresses their grievances. But even as the intern doctors embarked on phase 2 of their strike, clinical officers who have been on strike for more than 3 months called off their strike after signing a return to work formula. NTV's Brian Mushiri has that report.
60 days after the signing of a return-to-work formula between the government and the Kenya Medical Practitioners, Pharmacists and Dentists Union (KMPDU), with a promise that issues affecting medical interns will be resolved, hundreds of medical interns on Monday staged a peaceful demonstration outside the Ministry of Health headquarters, demanding to be posted immediately. Majority of the interns who have been waiting for internship letters for almost 2 years say that they have lost hope with KMPDU officials whom they accuse of fighting for themselves.
KMPDU is talking of batch posting and according to CBA, and it's like they are comfortable with it, and it's like they are saving the face of Ministry of Health, which have been sleeping on their jobs, and they are very incompetent. The impunity here is saddening.
By 8 a.m. Monday, KMPDU Secretary General Davji Atela had arrived at Afya House for a closed-door meeting with Health Cabinet Secretary Susan Nakumincha, among other Health Ministry officials, over the promises the government made during the signing of the return-to-work formula. By 9:35 a.m., just before the interns showed up, Dr. Atela drove out of Afya House. Minutes later, CS Nakumincha would also leave Afya House, with officials disclosing to NTV that they were moving their discussions to Treasury as the stalemate over payment and posting of medical interns intensifies.
I want to ask His Excellency the President, you promised us that you will post the interns. May you please keep your word, work with your CS to ensure that this is done. Otherwise, you are not living here without the letters. And Nakumincha, you have to listen to us. You are serving us, you have to listen to us.
This as clinical officers who have been on strike for the last 99 days are now expected to go back to work from Tuesday morning, as the National Union called off their strike, apart from those working in national government hospitals, where the union accuses the Ministry of Health of infamy. According to the Clinical Officers National Secretary General George Gibore, the county governments through the Council of Governors have kept their end of the bargain, especially on issuance of insurance covers for clinical officers, as well as an affirmation on non-victimization. COG further urged Kenyans to register for the ongoing shift.
We, the clinical officer, are your complement, not your enemy. We can work together to better the service of our people and to ensure, for us, when we are there, we are only asking for accountability or for enhancement of the existing laws.
I am positive. In the 60 days that we have agreed, it will be possible to have all the 47 counties with their staff having medical cover, because it's the right thing to do. We need our staff to be comfortable and to be confident when they offer services to our people.
Brian Mushiri, NTV, Nairobi.